There is, medical misogyny within healthcare. We see that with the fact that at the a recent health summit, 2 out of 3 women said they'd experienced discrimination. We know that when you come in with heavy vaginal bleeding or PMS or irregular cycles, often things are dismissed. I've been told myself throughout my life that PMS is normal, and I'm like, once I became a GP, I went, I can fix this. I actually know there are options out there. I'd lived medical misogyny. So, we know that it's harder for women to get diagnosed with something like endometriosis. There's a delay of about 7 years to diagnosis. So there's a problem within the profession. I think we need to actually educate children from a young age more on what's normal. What's normal with your period, with PMS? When is period pain not normal? When should you seek help so people can better advocate for themselves through the system? And there's also clinical trial representation, which we know women are historically underrepresented in clinical trials. Again, medical misogyny, hip implants, they studied them on men, put them into women and didn't take into account there are anatomical and hormonal and physiological differences. So all of these things have contributed to this problem. And I think there are, multiple areas where things really need to change.
Medical misogyny is definitely a thing. There's a lot of intrinsic and systemic bias against women in healthcare. There's assumptions that are made about people's pain experience and about the causes of various symptoms that people experience at times. I have to say the Assistant Minister for Health, Jed Carney, is very aware of this, and I've been working with her for the last 3 years on some of these issues. I know Mark can speak to the things that have been done with endometriosis and the like, but I think there's an increasing awareness of this problem. It's entrenched. In many cases, it's sort of generationally entrenched, and so it's not something that we're going to be able to deal with overnight. We also have a bit of a problem in our Medicare system, though, with the lumping of things into different sorts of conditions and things over time. We have a problem with complex and chronic disease in this country and our failure to deal with it through Medicare, the way that we do billing, the way that people, we reward speed, not need. In GP practices. People with complex, difficult problems are often difficult to tease out in our medical system, and it's not just medical misogyny. Sometimes it's just the fact that the GPs are trying to get through their consult in 15 minutes so that they can pay the bills.